Today we will look at the Norwood 5 patient. He has some hair on the top side, but they are looking really weak. But the donor looks good enough. We will check the whole process: the donor side, the top side hair situation, and then how many grafts he need. Okay, turn the screen.
So donor, we are cutting around like this part and taking out the graft and say one graft but has 3 hairs, 2 hairs, 3. His multiple rate is really good. And multiple rate, the most important thing is to do about the transplantation means that if we transplant like this, double 4,000 grafts, he will have approximately 8,000 pairs. On this job, donor condition, donor density is really, really important. And today we are lucky because we have really good donor. And also skin condition, skin looks good. There isn't any dermatitis, any psoriasis, any eczema, which is important for healing process. When we tested top side hair, it looks like a hairy, but you can see this hair condition. Look, they are very thick. And also, maybe you are noticing that discoloration around the hair, look, the yellow one. With our whole process, first we are checking the donor. We check the donor. Donor is really good. We have really good donor. And then last thing for the donors as well. The hair multiple rate is good, but how about the hair thickness, hair color? Some thick hair, you are seeing it on the social media, they are looking very good. If the hair is thick, okay, you can see like this result. But if the hair is thick, you cannot reach good enough volume with similar number of grafts for centimeters square. And first, is to check the hair thickness. After that, you decide how many grafts you put each centimeter square. And I measure 3 hair and then take the average. At the end of the calculating, he has 5.2 micron hair. In European side, the hair thickness change between 3 and 7 micron. We are saying medium level 4.5 to 5.5. His hair is 5.2, and in medium level is good. Not too thin, not too thick. We will arrange the distribution, how many grafts each area, compare his hair thickness and also hair multiple rate. If the hair thick, you can use a little bit less graft for each centimeter square, but if the hair is thin, needs to put a little bit more graft for each centimeter square. Normally, we are doing the hairline design in the operational room, but now, for the examine, just we will check how many centimeters square the CP entire we have to decide the graft number. And for this calculation, I will immediately estimate line. This is a very fast drawing. Normally, it's taking 15 minutes, sometimes more than 10 minutes, sometimes half hour, because the hairline arrangement is really important for this. On this job, first goal is to unvisible and natural design, and the hairline, the important thing for the natural looking. This is just fast drawing, and with fast drawing, we are measuring this side and taking half to arrange the starting point. There's 3 main area on the face, and if each area near them needs to be well proportioned. He's on 30s age and do it like this, the corner, open the eye on both temple, it can provide us natural looking. I don't like to use the very sharp, straight hair line. It can be look fake. And with this fast drawing, I will measure the whole area as centimeters square, and then we'll decide the how many graph put front, how many graph for medium, how many graph for crown zone. Sometimes some engineer coming here and they are saying, doctor, you are doctor or engineer, there is a lot equipment like ours, like engineering equipment. But okay, this job needs art, also engine, also math. And change the geometric shape to all recipient area to measure easily. Okay, some engineer can see me and then they can say, doctor, this is the oval zone and how is measuring like this methodology? But I did 3D scanner. It's very near. If you know the math, if you know the calculation, like this oval zone, you can really calculate easily, correctly. And we knows now we know the hair thickness, multiple rate, how many centimeters square our recipient area, and we will plan his job. This frontal area is more graph for each centimeter square. Like this 5,000, 5.2 hair, if put 44, 43 graph each centimeter square, 43, 44, it's enough for the good enough coverage. With 44 grafts, just frontal zone, small part, 1,450 grafts. It's looking too much, but our main area, because all sun coming here, and we need this hype skin, we need to cover the whole skin for the easy combi style for the good enough nature. And second part, we will decrease the number of grafts for each centimeter square, 35. With 35 grafts, the second part is 2,500. 2,500 here, 1,500 approximately here, means that till here we will use 4,000 grafts. Okay, like this North 5 case, coverage in a session is a little bit hard, you know, too big. You see pink area. We are doing mostly 4,000, 4,500 a day. Normally we need to cover the hair, but I will put some graph also crown, like 500, 700, to do it a little bit denser here for first session. After that, he can cover the easily and he can make the second session few years. After few years we can do it second session. Maybe we don't need second session, you know, this is the naturality. Some man losing the hair from the crown and it can look natural and he can feel happy with the frontal looking. Maybe you don't need second session, but if you don't like this crown area situation, we can do it second session in future, plus next year, maybe next few years later.
we did the hairline during the examination. With what it was the first line. We will draw again more symmetric and more proper one. The rules is same to that part, and take the half. Here is our starting point. Every head shape is different, both sides won't be symmetric anytime, but if the measure the both sides and arrange the symmetric ones, it can help the arrange well proportion. First, like this. After then, we will sit up and then check the line again. Okay. You can understand easy. This part looking a little bit lower, this part a little bit up. But there is the methodology. If you patient lift up the eyebrow like this, bir kaşlarını kaldırır mısın abi? Yeah. There is bumble here. Look. And you need to stay above the bumble. If you put on the bumble or under the bumble, this transplanted hair can move every mimic, and movable area is not available to hair growing. After a few years, if you put the hair movable area, after few years, every moving can die to your transplanted hair. Okay. And also, this is the line. Yeah, you can check the line. There is good enough balance both sides, and it's getting like this, like a natural design. If you do it like this very straight, it can be strange, because he's the 14 age. When he reached the 50 age, if there will be some straight line, it can be look weird, and it's really important for naturality. When we down the line, you can understand easily that natural proportion. And also look at upside again. His face, his face coming like this, and then there is bumble both side. Above the bumble, our line is coming. Look, we will focus till here. This part is really important for the density, for the thick looking and the image. After that, we will separate the remaining graph on crown, and also I will do it some random micro irregulation under the line to do it more natural. And if the look a little bit near, come on, you can see his hair direction. His hair coming like this and turning here. And we will follow also his original hair direction and angle to do it well designed on his hair. Yeah, it's going like this, and then here there is enough balance, and we will focus mostly here to do it well direction. And you have some existing hair, we will follow your existing hair angle and direction. It will lead us to do it well. It's important to have a little bit existing hair on the transplanted area, and we'll put some graft on the crown. Yeah, it will be a little bit dark than this, but not weight like this density on the crown. I will start the opening hole on this part, and I will arrange his hair direction and angle with our micro hole. and then we'll use the Yaman implanter to implant the hair graft. This part is really important. If you put the hair like this, it will grow through the eyes, and you need to arrange the really good direction, angle, and also direction. We are lucky we have a direction with our existing hair, because he has too much existing hair, and we can see their direction. It's like this, but you can build a new angle and direction with all baldness patient, but every time direction needs to go like this, and patient can comb the hair to the front, to the back, to all area. Check. Yeah. Look at the line. It's really good. That there's the good enough irregulation, and it's really proper the head form, head shape, and look, a little bit around there. Yeah. It's amazing. Healing going well. There's an accident scar here. This accident is very common. Get in the car or get off the car, during that time you need to be very careful. It can be happen like this. It's really important. Uh, mm, at least there isn't too much damage, but few grafts taken out from the car accident. But the other side looks amazing, really. I like it. Look at the density, come on the near, and then check the all detail. Look, it's super. Super healing, super density and angle, and there's slight swelling. It's too normal, especially first 2-3 days. If you rest enough, it's getting like this, not too much swelling. And I want to show the donor also with like this extraction, big extraction, more than 4,000. You can see the donor area. The extraction size is really small, and there isn't too much extraction, and it's looking completely healed, and most probably after a few months there won't be visible scar on the donor zone. And look at the crown area. Okay, with our case we are very careful to do the good density on the frontal area. The density getting a little bit less when we reach the crown, but we put it also a good enough graph on crown. There's different direction. This side here is different direction. This is they are going to the front. They are turning like this, and completely amazing job, and looks really good. Check. Yeah. Look at the line. It's really good. That there's the good enough irregulation, and it's really proper the head form, head shape, and look, a little bit around there. Yeah. It's amazing. Healing going well. There's an accident scar here. This accident is very common. Get in the car or get off the car, during that time you need to be very careful. It can be happen like this. It's really important. Uh, mm, at least there isn't too much damage, but few grafts taken out from the car accident. But the other side looks amazing, really. I like it. Look at the density, come on the near, and then check the all detail. Look, it's super. Super healing, super density and angle, and there's slight swelling. It's too normal, especially first 2 3 days. If you rest enough, it's getting like this, not too much swelling. And I want to show the donor also with like this extraction, the big extraction more than 4,000. You can see the donor area. The extraction size is really small, and there isn't too much extraction, and it's looking completely healed, and most probably after a few months there won't be visible scar on the donor zone. And look at the crown area. Okay, with our case we are very careful to do the good density on the frontal area. The density getting a little bit less when we reach the crown, but we put it also a good enough graph on crown. There's different direction. This side here is different direction. This is they are going to the front. They are turning like this, and completely amazing job, and looks really good. Hello. This is a common question. After how many days can I turn my job? Can will join the social life? The answer is here. Look, just 10 days. After 10 days looking, will like this. After 10 days, it will look like this, and with this looking, you can join the social life, you can go to the work, you can do everything. Frontal zone is here, will look like this after 10 days, and the donor zone will look like this after 10 days. Means after 10 days you can go to everywhere with not visible hair transplant, looking to the darkness, the redness, anything. It's here. Yes. Then we will search again to detail. Look, this is the first 10 days looking. There's enough hair, enough coverage, and their angle is here, density is here, and our hair will regrow like this process till the crown. And donor looks like this after 10 days. Okay, it's looking a little bit rare, but there will be some new growing around it after 3.5 months. It will look better than this after 3.5 months, but after 10 days you can go anywhere like this situation, and you can be feel free.